And we would now like to welcome the JN. So we are basically going on break now officially, but meanwhile, I think Johnson & Johnson, our sponsors, are going to have some presentations. I gather it's around 20 to 30 minutes, I'm told. And once that session is finished, after that, we'll be proceeding to the Aussie session. So stage is now on to the J&J guys, and simultaneously people can have a break if needed as well, have a coffee sandwich. Thank you.
Good afternoon, everyone. I'm just going to share my screen. Can someone confirm that they can see this presentation?
Yes, ma'am.
Thank you so much. Thank you. So we're going to start. It's a pleasure to be joining your LIBSS conference today, 2021. My name is Cindy Sampson. I'm a Metabolic Partnership Development Manager for Ethicon Johnson & Johnson. Today on the call, we have our Solutions Architect Director, Bala. Bala, are you on the call? I just want to make sure you're here.
I am, yep. Hello, everyone.
Hi there, Bala. And then we've also got Thomas Gamble, who's also Metabolic Partnership Development Manager and a part of the metabolic team for Johnson & Johnson. So you usually would know us for products that you use in bariatric surgery, whether it may be the harmonic devices for energy that you use, or whether it may be the echelon stapling that you use for your sleeves, etc. But today we wanted to talk to you and share with you how Johnson & Johnson are investing in the metabolic space and how it really means a lot to us in terms of innovation and partnership with the NHS. You'll notice in the middle of the screen that there's a QR code. The QR code is going to be on every slide at the top right-hand corner of every slide. If there's anything that jumps out to you throughout this presentation, please do not hesitate to go onto the QR code landing page, and it literally just asks you for a few details for us to be able to connect with you. We're happy to come and meet you or have a virtual call if you would like to know more about what we speak about today. So the agenda for today is that we wanted to focus on sharing with you not just about products, but also talking to you about why we are looking to improve access for treatment for patients living with obesity. How can J&J support the trust, the NHS trust with our metabolic partnership and this new way of working, and the enabling technologies and solutions that we have that coincide with delivering on those gaps that we may identify. And then also in the immediate term, how we can support with our winter packages, especially coming up to Christmas, and looking at backlogs. So the why. So it's really important for us to be able to share today why we are so focused on looking at the metabolic space, mainly with regards to the impact on population health. Now, obesity is a gateway condition to around 400 other comorbidities, as you already know, such as type 2 diabetes, stroke, cardiovascular disease, renal conditions, and cancer. Especially with COVID-19 and the pandemic, that's definitely reinforced the need for quick action to tackle obesity. And we feel as an industry partner that it's our duty to work to drive policy change with the government and also yourselves as healthcare professionals to drive meaningful, lasting change and improve the quality of life for patients for generations to come. The second reason why is access to treatment. So currently there are 28.7% of adults in the UK that are obese and a further 35.6% that are overweight but not obese. The UK guidelines currently recommend that patients with obesity have access to surgery, but less than 1% of these patients are eligible for treatment. And they only currently receive, which is one of the lowest rates of access in the world. The other reason is looking at healthcare costs, of course. There's a huge impact in terms of costs. But we're taking a value-based healthcare approach, which is essentially looking at the most effective treatment, but delivering the most effective clinical outcomes for patients. The UK-wide NHS costs attributed to obesity are projected to reach 9.7 billion by 2050, which is all the more reason why we really think it's our duty to focus on the bariatric specialty in the metabolic space. So the metabolic team is basically comprised of individuals that are highly skilled, that have come from NHS backgrounds, from consultancy-based backgrounds, BI teams, etc., that really understand the NHS. So we have a really skilled team within our metabolic unit. And our main vision as one of the world's largest and most broadly based healthcare companies, as well as a major supplier for a partner of the NHS, we're determined in our mission, together with yourselves, to eradicate obesity in the UK and develop centre of excellence around the UK and be that example for the rest of the world. Our mission is to establish meaningful partnerships with the NHS and the government to help improve and drive support and awareness to help empower more patients to access metabolic surgery for treatment and obesity. So as I've already said, less than 1% of patients are eligible for surgery. 39% of those patients are COVID patients living with obesity. 2 times of those patients are more likely to need medical treatment. And as you know, with comorbidities, it costs the NHS over 5 billion per year. And as you know, with bariatric surgery, you eliminate that need sometimes for comorbidity treatment, such as diabetes. And diabetes costs the NHS 1 million per hour to treat. So looking at the metabolic space and bariatric surgery and metabolic patients means that we can really look at cost effectiveness and long-term treatment for comorbidities and savings there. So how can we help as a team? So our strategic capabilities enable us to partner with healthcare systems to focus on 3 main objectives. The first objective is to help hospitals be more efficient by providing the multidisciplinary, the MDT teams with tools to improve coordination and alignment, making sure processes are more standardized and all team members are motivated and engaged. Now, some of the questions that we have had over time in working in these metabolic partnerships are, well, we already have a great team, we already have improvement managers, we have operational teams, transformation teams, etc. But what we envision to do is to come in as part of the team and be that additional resource for you to help support you get you to those objectives and goals. The second main objective is to help hospitals achieve better clinical outcomes with reduced length of stay, but again, by helping the MDT team and their patients to stay connected throughout the care pathway using best-in-class digital technology, which Tom will go on to explain, and comprehensive disease management tools. And last but not least, it's to help hospitals increase patient satisfaction by empowering clinical outcomes and empowering patients to be actively involved in treatment and recovery, and really looking at the patient journey from start to finish, from all the way from tier 1 to tier 4. So it's looking at a whole systems approach. So the 4 main aspects that we look at within the partnership and within our team is looking at patient pathway optimization. So again, looking at all the way from tier 3 to tier 4, how your pathway works within your system, and really looking at improving outcomes in the patient experience, but also eliminating the inefficiencies and reducing cost of care. With that in mind, we also look at joining up with the ICS, understanding their objectives and aligning with their objectives to increase that change and to enable that change. We have a government affairs manager who looks at policy change, working with the government, Lord Pryor, to really look at partnering with healthcare systems to provide patient-centred care through tier 1 to 4 through engagement and patient awareness. which leads on to surgical excellence. So looking at developing world-class technologies, again, which Tom will talk to in a moment, to enhance surgical performance, theatre efficiencies, and optimizing surgical skills through education. And last but not least, we look at both bespoke package with you, in partnering with the NHS, by making sure that that it's a commercial option that is viable, that is compliant, and they're tailored bespoke solutions. In turn, they release value vouchers, and those value vouchers then release resources, and those resources can be used as additional help to improve those efficiencies that are identified. So what approach do we adopt? So we call it the lean approach, so patient pathway optimization. It's the lean management approach, and this enables us to have a proven methodology to help hospitals realize measurable pathway improvements. So we make sure that there are measurables here. And what we do, I'm just going to talk you through the actual pathway before I stop to ask if anyone has questions. But what we do is really look to come in as a team. We look to assess and identify areas of improvement and define the future state pathway. So we develop that by having customer interviews. We do a diagnostic health check, again by using lean management approach and a value stream mapping. And what we do at the end of this assessment is provide you with recommendations, and then we get together with yourselves to define and plan based on those recommendations, and we co-create a customized project definition and an implementation plan. Now, once we get to the implementation plan, we come in as a team and step by step put the future state pathway into place with measurables and a change management approach, which can include the technologies that we recommend that is part of our options and solutions, digital solutions part of the company, and then really look to implement that as part of your team, and then have measurables to make sure that we're achieving it, whether it may be a 1-year partnership, 3-year, or a 5-year partnership. And essentially, the outcome should be sustainably improve, right? To build a culture of continuous improvement until we get to that optimized pathway that that really leads into that centre of excellence. So that's essentially what we do as a metabolic team, and that is how we have been partnering with the NHS so far. And really, we look to get in contact with anybody that feels that they could really do with that. And it really does look at tiers 1 to 4, and especially for those surgeons on the team on the call today, looking at you in surgery in your day-to-day and really looking at how we can improve that. Now, of course, if we improve access within the tier 3 to tier 1 to tier 4 pathway, that would mean more patients have access to treatment. And if you have more access to treatment, you would be doing more surgeries. And if you do more surgeries, really look to help to identify how we build that infrastructure within the NHS and how we make it commercially possible, and looking to make those improvements. So I'm going to stop there for questions before Thomas Gamble actually talks to us about the digital technologies that we've identified that we have as solutions to really fill in those gaps to help support and implement those. So I'm just going to stop and ask if anyone has any questions so far. No? Okay, Tom, would you like to carry on with these solutions?
Yeah, absolutely. Thanks very much, Cindy. Hi, my name is Thomas Gamble. I'm Metabolic Partnership Manager with J&J. And further to what Cindy said, we can't, if we are going to improve outcomes and transform care experience, it's not just going to be able to do just a high quality implementation that we use in the perioperative space. We need to look at the whole system as well as the whole patient pathway, and enabling tech is going to help us in order to do that, to expand capacity, improve costs, but also increase that patient experience. It could be, and today I'm just going to run through quickly some of our technologies, but then go into more depth on one that's more specific about bariatric. So really to start off, looking at that pre-operative space, looking at that care for today and that digital care coordination. This allows you then to have coordination of care and standardization of key practices, but also engage with patients early on to ensure that we can start to embed those patient pathway optimization practices which we implement. Moving forward into the preoperative planning, visible patient, which provides what we say is a clear roadmap from surgery. Essentially, what this does is it converts your CT and MRI scans into a 3D model, which displays patient-specific anatomy, vasculature, and or localization of tumors to simulate surgical plans, which is designed to reduce operative time, length of stay, and surgical complications. Then moving forward then into the perioperative space, we have SPI, which is essentially synchronized surgical workflows. The aim of this is to reduce variability within the OR, synchronize the team, and enable them to access real-time data insights to improve their point of care. Moving forward then into the post-operative space, where you want to maintain that patient engagement. We've got Care for Today monitoring, which is a remote patient monitoring app, which allows direct feedback between the patient and the care team. This is previously where you would have your CNS, they would ring, but now you can get it automatically via the app. Then how do we then improve surgery and ensure that yourselves you are getting a more personalized care experience from the HCP point? CSATs is basically surgical skill enhancement. It combines data, analytics, and human insights to evaluate and improve surgeon skills. So it's confidential, but it's more so it's personalized and provides near real-time reviews and feedback. So next slide there. Cindy, please. But for us, what we're going to talk about today is Care for Today education, and how that impacts, particularly from a patient pathway optimization. And what we're looking to do from this side is, we can embed those patient pathway within the hospital, but a big part of that, and I suppose an unmet need, is the education of patients. So if patients are more educated, prepared, motivated, and empowered to proceed smoothly through the entire treatment pathway, it's going to improve the overall stay. But on this, hospital systems can sometimes find it challenging to maintain and consistently provide patients with the relevant information required, particularly now within the digital age. Only 9% of providers say they have the ability to offer all of the tools the patients expect from them. And then from a patient perspective, 90% of patients no longer feel obligated to stay with healthcare providers that don't deliver an overall satisfactory digital experience. So as we start to move into digital age, it's important that we're supporting hospitals on this. And a key element of that is, next slide, is the Care for Today, this one, Care for Today patient education mobile app. This allows the patients to keep their surgical plan on track by access to the right information and education materials. These can include brochures and articles, exercise videos and how-to videos, surgical animations, checklists, and frequently asked questions. And there's a few examples of those there, which empowers patients to take ownership of their pathway. Next slide. In terms of the content, there's a whole host of content here for that are pre-approved, which we can mix in with the hospital's own materials. So you can use a mixture of Johnson & Johnson and your own materials to educate patients. So this takes them through the pre, peri, and post-operative phase, such things as having a food diary, making smart goals brochure, but also healthy things and fitting the exercise into your life. So enabling patients to take ownership of their care. Next slide. Conscious of time, so I'll run through the benefits before we move on to the window packages. In terms of the potential benefits from patients, you get high quality education materials, but overall, like I've said, you can feel more prepared, more motivated, and empowered to proceed through the entire patient pathway. And that's what we found, particularly with bariatric patients, key. From a HCP aspect, it takes the burden off needing to update the app or materials or constantly. That's something that Johnson & Johnson themselves can do. But also, once they have these basic questions and this basic education, when you get that face-to-face time with your patient, you can ask more specific questions and have more visibility on what they're doing. So now, whereas before you'd hand them a paper, you can have this app and you can visualize exactly how often they opened it, and what works and what doesn't. So then you can start to tweak your own enhanced recovery protocols as well. From a non-clinical perspective, it may increase hospital attractiveness and increase referrals and overall patient satisfaction. It also may reduce length of stay and potentially reduce cancellations due to patient adherence to these protocols, which they wouldn't have previously. You can have certain KPIs, such as app downloads and average time spent on the app. If this is something that you think could be useful, it's something that our metabolic partnership managers and service solutions managers can work with you to customize. So that's it from my side. If you want to move up, conscious of time, if there's any questions, we might move forward to the winter packages and how we're adapting to help the NHS this winter.
Thanks, Tom. So I know we're up against it on time, so I'll do this very, very quickly. What we're doing within J&J Medical is identifying ways that we can support the NHS through this winter period. Obviously, the complications of a normal winter are tricky, but the complications of the COVID impact, which is obviously still having a long tail in terms of its impact, is the key to us trying to find ways that we can support the system. So we've got capabilities in loads of areas, but the 5 on screen are the ones that we have the ability to deploy very, very quickly, and that's looking at how people are managing waiting lists, stuff that people do inside patient pathway and pitch efficiency, which Cindy and Tom have alluded to. Resource centres and resilience boosters for things like wellness for staff. I know that's a huge issue for a lot of NHS staff at this moment in time. Working with ICSs around weekend super lists and going through sort of high volume, low complexity workload. We're looking at ways that we can put physical capacity, i.e. temporary theatres, EP cath labs and staffing to go alongside it into the system. And also working with the private sector to see where there is redundant capacity, empty theatre space that we can get work from the waiting list moved over and across into, to make sure that the waiting list don't grow any further. So very, very quickly, there are a lot of capabilities that J&J Medical have, and we're making them available to the NHS across the winter, and will continue to do so into next year. I think that's the last slide. So with that, are there any questions? And if not, we're more than happy to give you some time back.
Yeah, again, if there's no questions, you can then utilize this QR code to get in touch, and then a local representative will then get in touch with yourselves.
Thank you, gentlemen. It was Mr. Agrawal here. Thank you for coming, and thank you for presenting. Obviously, there are a lot of panels on the chairs you can see, but I'm not sure if anybody wants to speak to any one of you. But I do know Cindy well for a long time. She comes to my hospital quite regularly, used to at least. She has been on a break at the moment, not since the pandemic. Have you been well, Cindy?
I have been well. I've not been on a break. I've been in a new role, but I'm glad to know that. Glad to see that you still remember me, though.
Fantastic. What I can say, a lot of information to give. Question is, how do you think the NHS will spend these money? Like, do you think the NHS will give you money to invest in these educational things, or that comes as a part of the deal which you do with when you buy their kit?
And I think in general, there has to be something in it for both sides inside the deal. So I think the NHS needs to know that it's getting value for money in whatever it's doing. And that means whatever the priority is right now, whether that's waiting lists, whether that's dealing with the obesity burden, or whether that's COVID, or a combination of them all. It's incumbent on us to prove that the stuff that we're doing will release benefits back to the system, and then it's incumbent on the system to make sure that they're working with suppliers and rewarding them fairly inside that. So I think the NHS is open to these discussions. It always has been. The complication is there are bigger things happening at the same time with COVID and other things. So it's competing priorities.
Yeah, no, I agree. Especially the pandemic has not helped anybody, especially you. I think how much is it? Is it back to near pre-pandemic levels, or you don't think it's still back in UK?
So personally, and Thomas, Cindy, correct me if you think differently, but personally, I don't see the procedure numbers to be anywhere near where 2018 or 19 were. So I know. Obviously, it's a lot better than it was last year, and I think the vaccination program has helped because patients aren't staying as long with COVID inside the system. But I don't think we're anywhere near those procedure numbers, especially if you look at yourselves and things like orthopedics. That they've been put into a holding pattern, and those lists are getting longer and longer. So something has to be done to fix it, because
Yeah.
we can't continue to add to the list and not operate.
Yeah, no, I agree. And
I think the
it's
other
probably
point to
going to
add,
get worse in the next month or two. If we follow the euro for a month, I foresee it will get worse in the next month or two in London as well, or UK in particular. Sorry, Cindy, I stopped you. Go on.
no, I was just saying that the thing to add there is that with regards to waiting lists, etc., it hasn't been the same. We have definitely seen that, but in having the conversations with other NHS partners, the thing that they've expressed as well is that they've they haven't returned to the capacity that they had before, and that's the things that have been expressed to us that they would like help with. So that is something we've been doing in the time that we've been having those conversations. So I'm happy to have those conversations with you guys, with anyone that would like to reach out and see how we can help.
I'm sure there are many delegates who are listening at this stage, so I'm sure they will contact your local team in the near future. Thank you very much, ladies and gentlemen. Thank you for joining us.
Thank you so much. Take care. Have a good day.
Yeah, you too. Bye.
Bye.